Welcome to this week's Silicon Slopes Town Hall. It is Monday, and I want to address the elephant in the room right out of the gate. No, I no longer have a mustache. It was my wife's birthday on Friday. She hated the mustache. She hated the mustache so much that as a present to her on her birthday, I shaved the mustache. And she is happy, and I am very sad because I miss the mustache. But I don't know. It was a good birthday present for her, I guess. Let me give you some updates on the current conditions on COVID-19 as of April 13th. Today, the known cases are 2,363. The known deaths are 18. Total amount of people tested is 45,787, and the hospitalizations are 201. We have a major update on the Silicon Slopes front when it comes to testutah.com and with the state health department. Today in a press conference, Dr. Angela Dunn announced that any Utahn who is experiencing any of these 6 symptoms should take a test. So any Utahn who has these 6 symptoms should take a test. And that is a fever, a cough, shortness of breath, sore throat, muscle aches, or loss of taste or smell. Now, you can go to testutah.com right now and take the assessment, and we've updated the assessment to correlate with the new Utah Health Department guidelines that anyone who has any one of these 6 symptoms can get tested. So any one of those 6 symptoms, if you go take the testutah.com assessment, you will be able to get scheduled to be tested. This is critical. So you go to testutah.com. Even if you've taken the assessment in the past and it said, you don't need to get tested at this time, take it again. If you feel like you have any of those 6 symptoms, take it again. Go to testutah.com. We've updated the assessment in partnership with the Utah Health Department so that more people know this. So, and more people can get tested. So go to testutah.com. Even if you've already taken the assessment in the past, we want more people to have access to testing. The whole idea is every Utahn who wants to be tested can be tested and should be tested. That is the goal of testutah.com and all the other incredible partners doing this. I also want to remind people that all of the tests at testutah.com sites are free. It's free to get tested at a testutah.com site. We don't ask for your insurance. I say we, but it's not me. But the testutah.com sites, they don't ask for insurance. It's absolutely free. You don't pay anything. It takes about 5 minutes once you get scheduled and drive up. So make sure you go to testutah.com, take the assessment, even if you've taken it in the past and you're like, hey, it told me not to get tested, but I do want to get tested. Make sure you go there, retake the assessment because it's been updated as per the new health department guidelines. We have 4 locations open, one in Provo, one in Orem, one in Heber, and one in South Ogden, with more on the way. And to give you a full update on everything happening, I'm going to bring in Mark Newman, the CEO of Nomi Health, who is also the chair of the Silicon Slopes Serves Health Response Committee. Mark, give us an update.
Yeah, thanks, Clint. And you took all my thunder. You shared everything.
Oh, I'm sorry.
It's all right. It's all right. We're, I'll adapt and, just talk about other funny things, I guess. Here, we are having a great amount of volume. I actually just got the complete updated numbers because mine are from this morning. We actually had 995 tests today. Like, if you think about that, that's actually an incredible amount of volume, almost 1,000 tests a day. That in context is more than other states. So we are cranking, we're really ramping up. I couldn't be more proud of the team. So this day, it's the biggest test day so far. We've had over 70,000 people complete assessments. And like I said, over 1,000 tests done today. This is just getting started. We want to be by the beginning of next week, so 5-6 days from now, up to 2,000, 3,000 plus per day. So we're going to continue to crunch and drive volume and go through it. As Clint mentioned, we have four locations on the testing front: Orem, Provo, South Ogden, and Heber. We're adding 2 more this week: the airport and Washington City. And as the esteemed Angela Dunn shared, anyone with symptoms can now test cough, fever, muscle ache, shortness of breath, sore throat, loss of taste and smell, and go and create a profile on testutah.com, because we built in the opportunity to re-engage and stay engaged, so we can monitor it over time. Next up, as we kind of get capacity to where we want it to get it, we want to get the state back to work. We want everybody back moving. We want to rebuild that confidence gap we all have and kind of getting back to life, living again. And so we want to get this to the next step. Anyone can test. And that's where we're driving from a capacity standpoint. We do have one ask. Randomly, and I don't know if this is someone trying to take us down, but testutah.com is being blocked on Facebook. So, not sure what's up there. We're doing everything we can. Help us get the word out that it's legit. And we want to make sure that, everyone that wants to post about it, everyone that wants to share about it is getting shared the way we want it to be. So next up, 2,000 to 3,000 tests plus per day. We want to be at 3,000 plus no matter what. With a lot of movement, both on the community side as well as national side, we would really like to make Utah #1 in the nation, not only on per capita testing, to get the best data set possible between assessments as well as PCR-based physical testing. But there's a very cool opportunity here where we could link together, Intermountain and U of U and Revere and Stewart and everyone together into one holistic community platform for community testing. We think it'd just be magical, so we're working on that. And like I said, anyone can test. It's tied to capacity. We're going to be working incredibly hard to get to that point of scale, because we believe and know that's the way we get back to work. So there's a lot to do. People are obviously talking about opening up the county, the country, the state, you name it, kind of beginning of May. We all know what that means. We all know that we want a massive abundance of testing available at little to no cost to anybody. Test Utah, Silicon Slopes, we're doing our part. And to be very blunt, this is becoming an example for the nation. Our team has spent the last week on all sorts of the craziest calls we'd ever imagined with other states, companies, organizations, you name it. And we think the fun's is getting started. So thank you for all your support, but we're rolling. Any questions, Clint?
No, I apologize for stealing your thunder. But you have a lot of great information there. And why the heck is testutah.com being blocked on Facebook? That's a great question.
Yeah, no idea. That's I think if it was up to me, if I had to be the real conspiracy theorist here, it's probably like, I don't know, LabCorp or Quest or something being like, hey, we don't like this. That thing's out there. But no, they're all good partners, all good groups. We have no idea. We just want to figure it out.
We'll get it figured out. So just to recap, the assessment is updated on testutah.com. So if you've taken it before and it said you didn't need to get tested, do it again. Because the health department came out with new guidelines that anyone who has the following 6 symptoms should be tested. And that's a fever, a cough, shortness of breath, sore throat, muscle aches, or loss of taste or smell. So take it again. Encourage those who have taken it in the past, or those who are feeling any of those 6 symptoms, to go to testutah.com and take that test.
Perfect.
And now,
there's 2 questions in the Q&A I want to make sure we answer now, just while we're on kind of the testing concept.
Yep.
One is there any consideration for travelers coming into the state that don't have symptoms? That's being worked through. If you've noticed, well, I don't think any of you have driven outside the state in the last while, but the state's actually even implemented geolocation-based messaging. So when you cross in through the points of entry, it sends you a survey to ask about symptoms, where your end point of entry is, and what have you. Amazing, and a very, very cool deployment of tech in partnership with Utah. The second is, and so in terms of traveling for consideration coming into the state, there's been nothing definitive yet. That's obviously has broad implications both locally as well as nationally. But for instance, Hawaii implemented a 14-day quarantine requirement for anyone coming to visit the state. So we're not sure how it ends up shaking out here in Utah, but we're working with our state leaders to figure out the right policy. Second, and this one keeps coming up, NEATA on antibody testing. So antibody testing is either the blood prick or like the seeing if it's inside your system. I'll say that there's been a lot of puts and takes on there. Positive, obviously the FDA and a lot of groups are chasing after it. Negative, and I'd implore anybody before going out and either buying some that are offered for sale or thrown out there online, it is the wild west right now for fraud. There are all sorts of people that are just throwing out these devices saying, oh, look, it's real, it works, blah, 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 with no actual validity behind it. And the acceptance standards aren't that high. And so be really mindful of it. Two kind of other disappointing pieces we've seen is one, Oxford in the UK said that it didn't work in England. They had 3.5 million devices and they ended up just chucking them. And we've heard of other universities kind of dealing with the idea that antibodies show up, but they aren't specific for COVID-19. And so people are working through it. I think the whole world of testing changes over the next 90 days. Intermountain, the U of U, other people, other great organizations are going after this. Just be buyer beware at this point. For our Test Utah initiative, as soon as it's ready, as soon as it's legit, it's moving. We have great vendors that have proven, validated, you name it. We're going to incorporate that into our strategy so that we can broaden the funnel even further to get Utah back to work.
And I will say ARUP announced, was it yesterday, Mark, that they're going to come out with an antibody test over the next few weeks. I believe that's going to be in partnership with the University of Utah and University of Utah Health. And we're going to have University of Utah Health Plans, Chad Westover, on here in a second, the CEO of University of Utah Health Plans. So testutah.com right now, no antibody tests. As I understand it, no antibody tests at all in Utah, although, there are people like ARUP who are working on this. And once, like Mark said, once it's validated and solidified, we'll bring it to testutah.com. Anything else we need to cover?
We live in Utah, the home of the lean startup and home of nail it then scale it. And I'd implore the same thing on the antibody testing. First, you got to nail it. Validity, it works, it's repeatable, it's easy to use. You go through the experience, anyone can do it, and then we scale it. There's 330 million people in America, 3 million in Utah. 5,000 tests a day isn't success. And so, we got to keep going. And if we're going to get back to living, we need to make sure that anyone can have access anytime. And so every one of these things are arrows in the quiver for us to go after this.
That's great. And we have Congressman Ben McAdams with us, who a lot of people know had coronavirus. He had COVID-19. So let's check in with you, Congressman. How are you feeling?
Yeah, I'm actually feeling really great. Thank you for asking. I had a kind of a rough go of it, as many of you know. So let me say thank you to Chad for the great healthcare I got, and I'm better now. And I was in the hospital for 8 days. So maybe I'll just take a second and describe kind of my experience before I dive into some of the policy stuff I was hoping to talk about. But and by the way, Mark, I like the facial hair, and Clint, I'm sorry, my wife's telling me to get rid of mine too, but her birthday is not till July, so we got some time. On the evening of March 14th, so Saturday evening, March 14th, I started feeling a little bit off. I just kind of felt run down, had some aches and that, and I hadn't slept much for the previous few days, so I just thought, I'll go to bed early and try and sleep it off. And I woke up Sunday morning and still felt not great, and so called the doctor on Sunday morning. It was the start of kind of the COVID-19 fear, and that my doctor said that it didn't sound, I didn't have the full array of symptoms. I'd be tested by today's standards, but by the standards of March 15th, they said just, I should be cautious, stay home, isolate myself, and watch my symptoms to see if they got worse. And so Monday night, as I was trying to go to sleep, and that it took a turn for the worse. My fever shot up to about 102 degrees. Felt it kind of move into my lungs. It got harder to breathe. And so on Tuesday morning, I called my doctor and described those symptoms, and he said that I should at that point go get tested. So I went up to we didn't have testutah.com, which, by the way, I've also done the test at testutah.com. It was post symptoms, and it seems like it processed my status really well. But so I went and got tested here at the drive-through clinic near our house, and test came back positive. And so I stayed at home, continued to stay at home. I was already doing that, and working from home and doing a lot of video conferences like this. And then it was Friday night, it kind of entered the third phase where it got even worse. I was in bed sick, and I couldn't stand up to walk across the room without having to stop and lean on the dresser and catch my breath, and was just exhausted. So called my doctor again, and my doctor said that I should go to the hospital and check in, and they would check my oxygen levels, and they did, and they were low. And so they put me on supplemental oxygen. I spent 8 nights in the hospital, sickest I've ever been. I've never been in the hospital before as a patient. So sickest I've ever been. I was there for 8 nights and checked out the following Saturday, and spent a few days in quarantine here at home in kind of a basement bedroom, and then have kind of resumed daily life. Got back to work and working hard. Still practicing the social distancing and isolation. I'm lucky to have a job where I can work from home. I'm working long hours, but I can do it by telephone and by video conference. So working hard, and want to talk a little bit about that. Happy to share some of the stuff that's coming from at the congressional level. And we appreciate everything that our private sector here in Utah is doing. You're correct to say that we are getting, I know you guys are spending a lot of time on the phone, but a lot of people are asking me about what Utah's doing and how Utah's doing it. And you guys are making us all look good. So we appreciate what you're doing, and encourage people to take the test if you haven't yet at test.utah, and then it'll follow up and let you know if you should actually take a physical test for the virus. Look forward to the antibody test coming out soon too. I think it would be a miracle if my family didn't get it. None of them had symptoms. My wife had a sore throat for a couple of days, which also at the time did not warrant testing. So curious to see if any of my family has antibodies, and to what extent we can start venturing out, because we have developed some natural immunity to it. And I think that what you are doing, private sector led, it will be the key to reopening our state, getting people back to work, and rebuilding our economy. But we've got to do it responsibly. We got to make sure that that by opening, we don't subject ourselves to another wave of the pandemic. And really, testing is going to be the key to that, be the key to reviving our economy and getting people back to prosperous times that we were enjoying just a few months ago. So thank you for all you're doing. Just wanted to talk about a couple of things that are happening at the congressional level, and I may keep my remarks short so that you can ask any questions, but I gather that by now you know a lot about this stuff. So the CARES Act was an economic relief package that's, and one of the focuses of that is getting out to our hospitals and our healthcare providers. So one of the ironies of this is we hear about flattening the curve so we can protect our healthcare system, and you're kind of left with this impression that our healthcare system just they're so busy because they have so many sick people due to the pandemic. And while it's true that we are worried about personal protective equipment, that we have ventilators and some of that, other aspects of the healthcare industry have been decimated, just like many other businesses, whether you're in orthopedics, dentistry. Think of all of the medical procedures that are not time sensitive, the hip replacements, the knee replacements, that can be deferred and that are being deferred. And you can't, if you're a dentist or an orthopedic surgeon, you don't just go out and treat coronavirus patients. You're out of work and you're laying people off. And so our healthcare industry is really getting hit hard today and in these times. So what we've done is we've got to support our healthcare system and making sure that it's got a solid foundation when we do open up and end the shutdown. So 2,000 Utah hospitals and healthcare providers are receiving about $185 million in emergency funding relief for the impact from the coronavirus response. Healthcare professionals nationally are receiving an initial payment of $30 billion for public health and social service emergency funds, which were included in the CARES Act and signed into law by the president. And the total fund for hospital providers is $100 billion. And that's to help to make sure that this testing can happen, that it's free, and that we can provide the care for people that we need to. Economic relief payments. So you're aware of the PPE, the Paycheck Protection Program, that helps small businesses keep employees on payroll. There's also the economic stability payments, the $1,200 per individual or $500 per child, that should be showing up in people's accounts this week. If you filed a tax return in 2018 or 2019, the IRS has your information, and they can either make a direct deposit, or they can send you a check. They'll do whatever way you got your tax return is how you'll get that amount. Social Security recipients don't have to do anything extra. So many Social Security recipients, since they don't have income, they won't file taxes. They will get that just through the normal course of however they get their Social Security checks. There's some low-income individuals who may not file taxes as well. Your disabled veterans who aren't required to file a tax return. And there's a place on the IRS website that those people can enter information. So help us get information out there that people know that that's coming. There are income caps on that. So if you are single and earn more than $75,000 a year, you won't qualify for that. Or married and filed jointly, it's $150,000 a year. That is where it ends. But if you are, you can go to irs.gov and see if you are eligible. Most likely you are if you earn under those amounts, and you should see those coming this week. And then just to reiterate Mark's points and Clint's points on testing again, our message and our efforts over the next month have to be testing, testing, testing. There's a lot of people are feeling cooped up. We have 4 kids. We're definitely feeling cooped up here at home, ready to get out. And the key to that is we cannot open up in an irresponsible way that brings this pandemic flooding back, and we have to go back into a shutdown. That would be devastating economically, as hard as it is right now. So testing, testing, testing has to be the focus of our efforts over the next month. People with symptoms need to be tested so they can self-quarantine. As soon as we have an antibody test, we can start deploying that. I think first and foremost, it needs to go to healthcare workers and people who are on the front line, so we can know who has natural immunity and start getting them out there and making sure they're safe. Those without symptoms eventually need to be tested when we have the capacity, so that we can identify where people are that could advertently spread the virus. I look at my own family. I think there's a pretty good chance they got it. And fortunately, we were quarantined and staying at home, but if they were out and didn't know that they had it, they could have spread it. So we need to be testing, need to get to the point that we can test broadly. And so that those who are mildly symptomatic or even asymptomatic can know and stay home, or know that they've got the antibodies and that they're ready to go back to work. And then contact tracing, which testutah.com is so good at, is once somebody has been confirmed positive, finding out who else they might have been in contact with and testing those individuals, even those who aren't symptomatic, so we can really prioritize that testing. I think we're sadly to the point that we're going to have to learn to live with this virus, including how we can reopen the economy and get people back to work safely until there's a vaccine. And their vaccine will come, but it's still probably a long ways off. Social distancing is a behavior that we can and we must do, and it helps tremendously, but testing and contact tracing are such important tools. So I want to again thank and commend Silicon Slopes and the private sector in conjunction with the state of Utah for really being a national leader in helping to innovate and find new ways to slow the spread of this virus and to help us survive economically. And then there's still a lot we've got to learn. As we're waiting for a vaccine, it's the therapies, and there are a lot of drugs that are being talked about as hopeful therapies. We need the science and the medical professionals through their clinical studies to tell us what's working, what combination of drugs works, so that if we can get to a point where this virus, it may still be out there and it may be among us as we're waiting for a vaccine, but that it's not deadly, that we have treatments that can keep people alive and until they can develop the antibodies and recover. That's going to be how we can deal with this. And so it's going to be an all hands on deck effort for some time still. But I really hope that we can start getting people back to work and prosperously contributing to our economy. And Utah's economy isn't fundamentally broken. So if we can get back out there safely, then then the roots of this economy, the foundation of our economy is strong, I'm confident that we can rise up above this and return to prosperous days that we experienced just recently. So thank you.
Congressman, you mentioned this. I have a quick question for you to go a little bit deeper on this Paycheck Protection
Yeah.
Program. And, there's been some difficulties with the rollout at the federal level. I think a lot of that's getting figured out. But the Senate last week, as I understand it, tried to replenish the PPP program to put some more funding in there. I think to the tune of around $250 billion.
200. Yeah. Yeah.
Is that right?
Yeah.
What is your position on that? Should that happen?
Well, I think that the payroll protection program is critical to keeping our economy on life support. So that it's somebody described the payroll protection program maybe as the ventilator that's keeping our economy going until the patient can once again breathe on its own. So it seems there have been some hiccups in the rollout, as you explained, with the some of the Treasury regulations and the Small Business Administration guidance on that. And so I know people are anxious to get that out. And that's quite frankly, when I say I'm working long hours, it is working with the banks and working with the small businesses and working with the government agencies that are rolling this out, trying to troubleshoot on a case-by-case basis and at a macro level to get that money out as quickly as possible. It does seem that the money will run out. And a lot of businesses are panicked about that where are they in line, and will there be water to make it to the end of the row so they can benefit from that. And so there's some fear about that. I absolutely support increasing that funding so that more businesses can rely on it. I'm not a senator, obviously, and so as I understand the debate is not about whether or not to infuse more money into that PPP program. There are some naysayers, but it seems that there's broad consensus in the Senate to do that. As I understand the debate, the concern is around the healthcare sector as well, and that I guess there are probably two concerns. One, that we are also ensuring that our healthcare sector has a solid foundation, and if we keep the economy alive, keep the ventilator of the economy working, but the doctor isn't in, then it's not going to work. So we want to have a strong and solid foundation for the healthcare sector as we are also keeping the economy, the heart beating in the economy so that it can come thriving back. And then one of the concerns is the payroll protection program. And I don't mean this as a casting blame or a criticism, but as it went out, what you saw was those individuals who were able to be at the front of the line in applying for those funds were the more sophisticated borrowers. They're the ones who all the paperwork was already ready. They maybe have a rolling line of credit. They have established a relationship with the bank. And so they were able to jump in line very quickly and get their applications in. And the ones who that are at the back of the line are your less sophisticated businesses, your restaurants or your smaller mom and pop businesses. And they're struggling, and their lender probably isn't Chase Bank. Their lender might be the small bank on the corner, the credit union with $20 million under management, a small institution that was also less sophisticated about how to get these dollars out. And so the other concern I heard coming from the Senate is how do we make sure that this money makes it to the small mom and pop businesses as much as it makes it to the more sophisticated borrowers. And so that's the nature of the debate in the Senate. I think there are good points all around. My position has just been, everybody's got good points. We've got to get it done, cut a deal. I think I've been disappointed to see what I would call from both sides, Republicans and Democrats, a little bit of political posturing. Can we splash a little mud on the other side before we, in a game of chicken, and then we'll get it done at the end of the day. But let's see if we can splash a little mud on each other in the process. I think that's disgusting. That's what Washington seems to do. It's and in the meantime, small businesses here in Utah are struggling, are afraid, and I talk to them on a regular basis, and we try and, there's only so much I can do as a member of the legislative branch, but they're really worried. And so my message to the Senate would be, put your political party affiliation aside, listen to the good arguments on both sides, and then work to just cut a deal and get legislation and get it over the House so I can vote on it, and we can keep this important program going.
Well, Congressman, it's good to see you up and about and healthy and looking good. And I said this when you first got out of the hospital, and I mean it. The facial hair is remarkable.
Yeah.
Don't cave like I've caved here because your wife wants you to shave it. Keep that thing. You look amazing, my friend. Thanks for everything you're doing.
You bet. Hey, last thing, a little fun fact. So last time you had me on, it was when it was Wednesday, and I just finished my presentation. I got a phone call, and I popped off to listen to the voicemail to find out I was COVID-19 positive. So it's good to be back. I felt like this was closure. I needed to come back to Silicon Slopes, healthy and feeling good. So thank you.
Well, hopefully you get a good call this time
Yeah,
once you
right.
come off here and not another bad call. That wouldn't be good. But thanks so much, Congressman. Really
Thank
appreciate
you.
it. And sorry, we're like part of your memory of you getting tested positive for coronavirus.
It's a good memory. I'm feeling good. So thank you.
Thanks, Congressman. Now I want to go to the CEO of University of Utah Health Plans, Chad Westover, to get an update on how health plans and our healthcare system is reacting to all this. Chad, how are you, my friend?
Great, Clint. Thank you, and well wishes to the congressman. Glad he's doing well, and glad that he's regained his strength. So that's great.
By the way, Chad, I don't know if you noticed, I flipped my hat forward, and now it's a University of Utah hat. Thank you for everything you and the University of Utah are doing, my friend. It's really remarkable.
Thank you. And I just wanted to show you the one
Utah. There we go.
So thank you to Silicon Slope Serves and Cotopaxi for that. So we're proud to be a part of that. So thank you, Clint, for giving some time. You know, the insurance industry as well as the healthcare industry working together, really trying to get people healthy, keep people healthy during this crisis. We're trying to do away with the things that really haven't led to a speedy recovery and to being able to allow those that need it to access the testing and the treatment. So, and I know I speak for certainly the University of Utah health plans, but also many other health insurers where we're just removing barriers where we can. Testing is done without cost, no copay, no deductible. We want people to get tested. If you need to get tested, go on testutah.com. I did it, everyone should do it. And get tested if you need to. And that will be done without copay or deductible. Also in-person office visits, urgent care emergency room, COVID related, it's all at 100%. We want to make sure that that's also telehealth visits. That's being done for COVID patients at 100%. So a lot of barriers are being taken down to try to make sure that we within the industry do what we can to make this accessible, financially affordable. But I don't want to forget also about those that have chronic conditions. I mean, there are those out there that are diabetic, asthmatic, that have maybe a high blood pressure, pregnant, depression, anxiety. There's a lot of chronic conditions that are out there that we still need to make sure that they get their regular checkups. So what we've done is we've added both video and telephonic audio options so that they can go to their current physicians. We've done a lot of work to make sure that they can access their current physicians and continue to have those regular checkups, to continue to have those visits. Extremely important that we do that. And I will say that at this time, mental health, and I appreciate you all from bringing in the mental health experts on this, because this is a really important piece for all of us to overcoming this. The Utah Crisis Line, it's administered by the University of Utah. Wanted to bring up that 801-587-3000 is the phone number. 587-3000, the Utah Crisis Line. The Safe UT app, also another way to do it, just download the Safe UT app and you're able to hit a button and get into one of the counselors there. So both those that are struggling with the virus, those that have chronic conditions, and those that may be experiencing some anxiety or depression, we all need to take care of ourselves at this important time.
Thanks so much, Chad. And I just want to reiterate the mental health number that's administered by the University of Utah, as well as the Safe Utah app, which is also administered by the University of Utah. That number is 801-587-3000. Thanks so much, Chad. Appreciate everything you do. Silicon Slopes appreciates the partnership that we have with you and your team and the entire university. And again, thank you. I mean, look at this hat, everyone.
I love it, Clint. Thank you.
Thanks,
one
Chad.
Utah, thanks.
Next, I want to go to my good friend, co-founder of Silicon Slopes, probably more importantly, the co-founder and CEO of Pluralsight. Probably not more importantly, but just as important.
Just as.
Aaron Sconard. And before we get started here, Aaron, it was your birthday yesterday. Happy birthday to you, my friend. And hope you and the family are well. Can you talk, you're doing something pretty incredible over at Pluralsight that I want people to know about. And then just generally, I'd love for you to talk and give some advice to other CEOs and leaders who are on the call on how they should be navigating this time. But you did something I think that's fairly remarkable, and you've given Pluralsight for free for the month of April. Can you talk about why you're doing that?
Absolutely. Look, this is an incredible and unprecedented time in so many ways. But one of the most remarkable stats right now is the 16 million people who are now unemployed in the US and many more globally. And so, look, we need to get those people back to work as quickly as possible, help them rebound from this awful circumstance with an even better career post-COVID. And so, Pluralsight has always been committed to helping people develop and acquire the most relevant skills today. And so we saw this opportunity as the perfect time for us to just open up free access to Pluralsight for the entire month of April and give people access, just an opening into this world of tech to learn some of the most valuable skills like AI, machine learning, cloud, data science, cybersecurity. Those are the skills that the businesses of today and tomorrow desperately need. And there's so many companies out there right now that can't fill the openings in those critical areas. And so we're hoping that this offer makes a difference for the unemployed and also the businesses who desperately need these new capabilities. And Clint, it's been incredible to see the response. And in the first 12 days, we opened it up on April 2nd. In the first 12 days, we've had over 700,000 people register, across 25 countries. And that's a massive increase to the total number of users we normally have on our platform. So it just highlights how important this time is, how much people need to focus on reinforcing and reinventing their careers. And Utah's all about tech. I mean, we have such a strong tech culture here, and we're seeing the hunger, just the opportunity in it for so many people around the world. So this is what Pluralsight's all about. Our mission is about democratizing tech skills to provide people opportunity globally to this, and we sure hope that it makes a difference here in Utah. I hope every company out there is pointing their developers, their own teams. If you're not a current Pluralsight customer, just point your people to it. You can sign up, no credit card required, no strings attached, full unlimited access for the entire month of April to learn as much as you want. We've also seen over 150,000 skill assessments taken in these first weeks, which shows me that people want to be able to demonstrate and prove that they've acquired these new skills, this new knowledge, so they can apply it to a new opportunity. So if you remember one thing from all of this, it's that upskilling in general during COVID, is the way to rebound. Companies, one of the things we've also seen during the last few crises that we've been through as a company is that a lot of companies decide to invest in tech during these times of recession, which is kind of counterintuitive. But the reason they do it is because the opportunity cost has lowered, right? When business is booming and things are just going great, no one wants to make a big strategic move to apply AI or machine learning to their business because it might dismantle the very things that are going well. But in these times, when things aren't going well and every business is being hit, it's about differentiation, it's about survival, and ultimately that means innovation. And so this is where you see the creativity flow, and that's why these companies will need these skills. So again, if you remember one thing from all of this, this is about helping all of those unemployed upskill, build the skills of the future that they need and that these companies need around the world. And that will hopefully make a difference during this very difficult time. So Clint, I'll just pause there and you guide me where you would like me to go next.
Perfect. And I want to point out that Silicon Slopes this morning tweeted out a link pushing this out. You can follow Aaron at Sconard on Twitter. Pluralsight has pushed this out. Any information on everything that Aaron just mentioned can be found easily on either the Silicon Slopes social media account, the Pluralsight, or Sconard's personal account. Hey, I just wonder real quick on the leadership front. And for so many people who are watching this, who are CEOs or leading organizations or companies and having to make some really difficult decisions during this time, what advice you might have?
Yeah, look, this is a time for leadership. Simply put, I mean, we need leadership, and that can happen across a business. I'm not saying it has to be the CEO or it has to be the VPs. It's a time for demonstrating leadership. And what that looks like in these difficult times is showing up with clarity of vision and purpose. You know, what's most important right now, being, just obsessive about your priorities and your focus, and bringing calm and hope and positivity to what is, for many people, a very scary and difficult time. And, what that looks like in every business is different right now, but those elements are there no matter who you are. And so, right now I'm spending a lot of time with my leaders. I'm spending a lot of time up here in my own head to make sure I'm in a good place, so I can show up effectively for my leaders. And I'm encouraging my leaders to think about the same things when they're showing up for their teams. And ultimately, leadership is about how we show up in these situations. What impact do we have on other people when we show up in a conversation, when we show up in a difficult decision, and do we leave people with more hope, with more clarity, with more optimism? And that's what the world desperately needs right now. So I think it's a time for all leaders, regardless of your role, to be thinking about those things, to be intentional about what you want to create in every opportunity, in every moment, and not lose sight of that. And that leadership is the thing that will propel us forward and take us to higher ground.
Thank you so much, my friend. And again, happy birthday. It's good to see you.
Thank you.
Good to see you virtually. I want to see you in person, but I don't think that's going to happen for a while. So good to see you, my friend.
Thanks for having me.
I want to go to the Tosh running coordinator for IHC, Rebecca Benyon, to get a sense for everything happening in her world and how we can stay fit and healthy during this time. Rebecca, how are you?
I'm doing well, thanks. How are you?
Doing very well. So can you explain what the Tosh running program is and ways that folks should be thinking about it during this time?
Yeah, so at Tosh, a lot of people know us for being the orthopedic specialty hospital for the surgery and physical therapy, but we do a lot of things for adult fitness and just keeping people in their overall health and conditioning. And I think one of the reasons it's so important right now is our physical health plays such a role in our mental health. And a little bit of physical activity helps us keep our mind clear. It improves our mood. Even just 5 minutes of exercise or getting up and moving can change your mood. So I think a lot of it is just remembering to get out and find ways to move. Even if you don't have 30 minutes all at once, you can break it up throughout the day and change your mood, change your outlook, get some fresh air, get that vitamin D, and you'll feel a lot better.
Thanks, Rebecca. How are you holding up? How's the team holding up?
Pretty well. Intermountain has been really good to make sure that everybody is able to work if there's positions available and redeploying people. And I think it's been great for all of us to appreciate what we do have and the opportunities that are in front of us to continue to grow together and improve.
Speaking of community health, I want to go now to Stacy Stanford, who's a health policy analyst at the Utah Health Policy Project, to get a sense for, community health issues during this time. Stacy, what do you have for us?
Yeah, I mean, this is such a time where existing health and social and economic issues are just exasperated, right? So Utah and the United States, we have a lot of health disparities. So a health disparity is an adverse health outcome that is avoidable, unjust, and unfair. And these are things like access to healthcare coverage, life expectancy, poor health in general. And we're just really seeing that COVID is like taking a spotlight and shining it onto these existing cracks in our system. We're seeing the examples in numbers that are coming out showing that our Black communities are being hit really hard, really disproportionately high death rates among the Black community in the United States. I know we don't have Utah specific data on that, last I heard. Another community that's obviously hit really hard is the disabled community, because when they say that people with underlying conditions are at greater risk, I mean, underlying condition is kind of another word for disability, depending on what that condition is. So, and beyond the high risk of COVID for disabled people, we're also looking at care rationing decisions. Even Utah's crisis management plan really deprioritizes saving the lives of some disabled people. So, and beyond that, I mean, people with mental illness or substance use disorder are really hurting during this time of isolation and suffering from that, even if they don't have COVID. And so we're seeing these ripple effects in our communities. And so really anywhere where somebody was hurting before this pandemic, they're really going to be hurting now. And so we've been thinking of solutions. UHPP, we focus on like underserved Utahns is how we phrase it. So more marginalized, oppressed, underserved communities. And so we're trying to think of policy recommendations from that lens. And so we sent a list of recommendations to people like Representative McAdams and state officials, and asking for things like, we need good data to account for race and ethnicity and disability and socioeconomic status. We need to make it easier to get and keep programs like Medicaid and food assistance and rent assistance. And these social safety net programs exist for this exact situation. And Medicaid especially really disproportionately benefits those targeted groups we were talking about that are more low income and more marginalized. And so now more than ever, we're seeing things like Medicaid be really important. And the state has taken some action right now. If you sign up for Medicaid, you're locked in and you keep those benefits until this state of emergency is over. So people at home, like, if your income is dropped, if you've had a change in income, Medicaid is based on household family size and income, and that's it. So if your earnings have dropped, you really might be eligible for this health insurance that has no premiums, very, very low $4 premium or copays, and you get to keep it until the crisis is over, no matter what. They can't kick you out. So things like that, we need to open up options for people who aren't eligible for Medicaid, who are uninsured and need options through other areas, and seeing coverage provisions and price reduction provisions in those areas. But what it really comes down to is these things that we're asking for are policies that we have needed for years and for decades, and it really just took this crisis to shine the light on it. And so we need to make a change so that the next pandemic, we're not playing catch up, we're prepared ahead of time.
Is there anything the Silicon Slopes or business community can do to help you in your efforts?
Man, we need to just get the word out there about some of these programs that are available. We need outreach. We need, when people, the governor, for example, during his press conferences will say, go to DWS, they have unemployment available, go get unemployment. He never mentions Medicaid though. So when you lose your job, there's a good chance you're losing your health insurance, and you might need help with that too. And so for the business community, especially, if you have to do a round of layoffs, I get it. That's happening all over the place. But if you know that your employees are seeing their income cut, mention unemployment, but tell them about Medicaid too, and let them know that the state has options for that as well. And so the business community can really amplify that healthcare is available outside of Cobra. We know Cobra exists, but that is so expensive. They might be able to go on the ACA Obamacare marketplace. They might be able to get Medicaid or CHIP or something like that. So we want to spread the word, definitely.
Thanks so much, Stacy. I just want to end here with a call to get everyone to go to testutah.com and take the assessment. Even if you've done it in the past, the state health department today updated and laxed what it takes to get tested by taking the assessment at testutah.com. If you have a fever, cough, shortness of breath, sore throat, muscle aches, loss of taste or smell, any of those things, you can get tested now. And that was updated just today. So if you go to testutah.com and take that assessment, you can learn, all those details, and you can get tested. As mentioned, like testutah.com now has 4 locations open. It's ramping up every single day. It's critical for either you or people you know. Please share for folks to go to testutah.com and take that assessment. I think that's going to be critical for us to get out of this thing. I want to thank everybody who came on today. Thank you for watching. This week will be the last time we do 2 of these per week. Starting next week, we'll just do 1 a week on Monday, because there's so many other things going on through this network. The economic committee is doing a weekly town hall as well. We want to open this up and really start, siloing where the problem is and letting other people have a voice and a microphone here. So we're going to go to 1 a week starting next week, but our next one will be Wednesday, this Wednesday at 4 p.m. Thank you all for tuning in. Have a good week.